So this is my last talk during this excellent conference. I've been exchanging ideas with the organizers and saying that to me this is one of the best programs that I have attended in the last couple of years and compares very well with programs within the American and the European glaucoma societies. And I thank you also for giving me the opportunity to speak about this very interesting topic, visual fields and do they improve. So just to kind of try to complement what Deepak was saying about visual field, I want to remind you of a few things that should be very important and we should keep in mind. First is the filling in capacity of our brain. Why wouldn't a glaucoma patient see a dark area during a scotoma? Because the brain does the job in once a scotoma is produced to filling in the space with colors and shapes from around the scotomatic area, which result in a phenomena where the patient is unable to detect that he has any defect, which has repercussions on, obviously, on detecting the disease, because it's, as you all know, is asymptomatic, but it also has a repercussion on the practical life of the patient and trying to convince our patients to stop driving. So how many visual fields do we need to do per year to determine progression, at least in the first 2 or 3 years after diagnosing glaucoma? So maybe with a show of hand, how many would do 1 visual field per year? How many would do 2? How many would do 3? And how many would do 4? Okay. So there's no specifically right answer, but if we have to venture into an answer, according to a recent study that was published by Bal Chauhan actually, and Ted Garraway-Heath, they recommend at least 3 per year, at least. And you have a better chance of detecting progression if you're doing 4 per year. Sequential visual field detection is something that I have more or less abandoned some years ago, and I really rely mainly on trend analysis rather than event analysis. So as you can see here, this is, to complement again what Deepak was saying, this is the Octopus software that looks at a trend analysis over time with a software called the iSuite, and would show you inverted red triangle if there's a statistically significant reduction or progression. It would be an empty triangle if it is attendance rather than with a statistical significance. And you can even have a green triangle that shows improvement. So this is an interesting example. This is a patient where we are including all his visual fields from 94 to 2001, and we can see that he has a significant reduction or progression over years. Now compare that to the same patient where we have not taken all his visual fields, but we have taken only the last few, and in that case the software would show you that he has been improving. That for me is very interesting, and it provides a word of caution for all of us. Because if you are relying on your technician to print out the visual fields or do the analysis and gives you the results in a piece of paper where you look and see if things are progressing or not, you are not always tapping into the wealth of information that you can get if you do the analysis yourself. So the iSuite software is something that you can upload on your computer, and your visual field machine can be connected to your computer in one way or another, multiple ways, and you can run down your own analyses based on the clinical relevance of the exams, because the technician at the best would choose some or will give you all, but you would know that in this specific year, for example, the patient had a phacoemulsification, or in this specific year we had moved from medical therapy into surgical therapy. Then you interpret the visual field results and stability versus progression in accordance to events that were important in the patient's situation. Now, we speak about the real topic that I was given. Can visual fields improve? And as everything goes back to George Spaeth, George in 1985 published a report on 70 patients that he had operated with a trabeculectomy, and showed over a period of 3 years that lowering of intraocular pressure can result in improved visual fields. Now, the glaucoma community or the ophthalmic community around the world was very skeptical about that. I mean, it was said that, well, the conventional wisdom goes that we have our retinal fiber layer, and once this is lost, the optic disc is getting excavated, and glaucoma is a one-way track where at best you can stop progression, but you cannot regain anything, with the exception perhaps of morphological changes that you can see in children in congenital glaucoma once you operate those patients. But then, many decades later, the researchers, among them again George Spaeth, who did the collaborative initial glaucoma treatment study, the CIGITS, which is a landmark study in our work, reanalyzed their patients. So what did they do? Well, first, remember that the CIGITS is a randomized controlled trial where they got early glaucoma patients and they randomized them for medications versus surgery. They included a big number of patients, 607 patients, and they started the enrollment in 93, they finished it in 97, and they continuously followed the patients from 93, 97 period up to 2004. And recently, 2 years ago, they published their results with the title Visual Field Improvement in the CIGITS trial. So what did they do? They first enrolled patients that had at least one reliable visual field test done, and then they did another 2 visual fields as a baseline, and they needed to make sure that there's no significant change between the 2 visual fields that we're taking for baseline. And if there was a change or a significant difference, they did a third. So we're talking about patients who had at least 3 or 4 visual field tests before being put into the trial as a baseline. And they repeated the visual fields in most cases every 3 months, and in some cases every 6 months. So you had a follow-up of at least 80 years for the majority of patients. Now, this is an interesting graph, and I need your full attention for that, because what you need to see is this is the percentage over time of decibels, percent of decibel gain or loss in this population of patients. Now, forget about this and basically continuously look at those 2 lines here, the dark line and the slightly less dark or grayish line. What you can see that at 5 years period, the number of people that have progressed was almost equal to the number of people who improved. So you had a group of people that were getting worse and a group of people that were getting better, and both at 5-year period was about 15%. So 15% of the CIGITS population went progressing and 15% went better. After 5 years, from 5 to 8, patients who have been getting better sort of plateaued, stabilized, while patients who were getting worse continued to rise up. So it's obviously of interest for us to look at those patients who have been improving. What can we correlate with their better improvement or with improvement of their visual field status and indices? Well, they had a better IOP control, better in terms of lower mean or lower minimal IOP, better in terms of a lower sustained levels of IOP over the follow-up. Females did better than males, probably because of compliance, and patients that were surgically treated did better, possibly because of removal of compliance factors, or perhaps because circulation improves in the head of the optic nerve in some cases after surgery. So in their discussion, they basically start the discussion by challenging the long-believed concept that the disease is progressive and visual field gain cannot be true. And I think they provide in the paper enough statistical power to show that these are not fluctuations or inter-observer changes. They're really and truly improvements. So what does that affect us as clinicians? Well, it provides hope. It provides hope for our patients, and it provides a message of hope that you can give your patients. You can say that a certain degree of patients can have an improvement of visual field. This is, I mean, a lot of us kind of ensure compliance by threatening our patients that they're going to go blind. Maybe you can now provide a carrot and reward them by saying, if you comply and if the pressure is low, you might have a good chance of improvement. Thank you very much for your attention.